Welcome back to my channel. This is your lady Saada Sadiq, a registered midwife with a BSc in midwifery, currently a senior midwifery officer with Kolebu Teaching Hospital. From my last video, I promised we're going to take the effect of diabetes on pregnancy and pregnancy on diabetes. Before we do that, if you haven't subscribed to my channel, kindly subscribe to my channel and hit the bell button below so you do not miss any video I upload when you are not online. Also, if you haven't joined my Facebook group, kindly do. The group is Search for Me. It is a group that talks about all aspects of health, just like we do here on YouTube. Let's refresh our mind from our last discussion. From our last video, we discovered that diabetes is high blood sugar, and if you have this condition, you tend up having a lot of glucose or sugar in your blood. So going down to pregnancy, in which the mother caters for 2, 3 more or 5 people, yes, there is going to be so much sugar in her blood. That is quite sad. And in this condition where the body can't break it down, the mother is going to have so much sugar in her blood vessels, and these are going to affect the function of the blood vessels and nerves. These can lead to hypertensive disorders such as preeclampsia, gestational hypertension, and eclampsia. Furthermore, the mother ends up being overweight, and she's also predisposed to a lot of infection such as vulvovaginitis, or should I say candidiasis, or we say white. Yes, because she is so much at risk, and the mother ends up being weak, and she can get next as about the effect of diabetes to the baby in the mother's womb. So when the mother has diabetes, it increases the blood sugar, thereby making the baby take in so much sugar at a point in time. Yeah, so in this condition, the baby ends up eating and becoming overweight, or the baby becomes very big. And also, when the baby takes in so much glucose from the mother's blood, the baby ends up urinating a lot, just like what happens in the adult as we discussed the symptoms of diabetes. So the babies end up urinating so much into their liquor, or should I say the water surrounding them. This also leads to a condition called polyhydramnios. So you might be told that there is so much water around your baby. Gestational diabetes, or if you're already diabetic, you are predisposed to this, and this can happen to your baby. Also, on the other side, since there is so much sugar in your system, and that can affect the blood vessel, it also affects the formation of the baby, leading to congenital abnormalities in utero, or should I say in your womb. So these are some of the things that can affect the baby when the baby is inside. In the latter part of the pregnancy, the placenta releases hormones like cortisol, and let me say human placental lactogen, and this hormones also have their effect of impairing the function of insulin. So thereby, when it gets to this stage, there is a bit of malfunctioning of the placenta. So if you are not careful, you can have a stillbirth at this stage. So mostly mothers with gestational diabetes, or gestational diabetes or diabetes in pregnancy, we encourage them to do something like a fetal kick count, which we teach them so they do daily to maintain the activity of the baby and to ensure that the baby is alive. So when we come to when the baby is coming out or during delivery, the mother is so much at risk for cesarean section. This is so because the baby is overweight or might be overweight depending on your management. And on the other hand, there could be what we call birth injury or birth trauma. So the baby's head can be traumatized, the shoulder can be traumatized, that is during vaginal delivery, and then we realize that the baby is so big. Because when there is overweight in a baby, the head becomes small and the body becomes big. But in a normal baby, the head is the largest part of the baby. Then on the other hand, when the baby is given birth to, your child is at risk of going into what we call hypoglycemia or low blood sugar in the baby's blood. This is because when the baby was in you, the baby was drawing glucose from you. The baby was drawing glucose from you, and now all of a sudden the baby is out. The placenta is disconnected through the cord from the baby, and the baby is no more getting any supply. So there could be a rapid low blood sugar in the babies, and this can affect their health. Some even lose their babies through that, but we are not expecting that, not at all. And on the other side, there could be what we call hyperbilirubin. I mean, that's a big word. So we'll discuss that later. But this can lead to neonatal jaundice. So we look out for all this in the baby, and we ensure one of the management with this kind of condition is to ensure that the baby is fed immediately after delivery, and then there is a frequent feeding almost every hourly to such a baby. But do you know something? One thing about these children is that they end up having childhood obesity because of what they experience at birth. So that is one of the things we look out for. So not forgetting, these babies are also at risk of respiratory distress during birth, or should I say after birth, when they come out. This is because of the effect on the blood vessels by hyperglycemia. That is, it has effect on the heart, the lungs, the brain. So this is something we also look out for in such babies. Talking about how best we are going to control our diabetes, the first thing is to seek medical care and to abide by all protocols that your physician advise you to. And if you are being referred to a dietitian, please do, because they are there to help us with the kind of diet to take. But for example, in my setting, that is Ghana, we have a lot of fruit and vegetables, and you can have a diet full of protein and vegetables so that you reduce the amount of carbohydrates to control your diet. It is a unya contom rebikra. It's gonna help you, you know, that if you get your bowl of salad full of lettuce, full of chicken to be your protein, or some meat and egg, this is going to help your diet. And the very one that we are most lazy in doing, that is to exercise. You need to exercise before even getting pregnant, so that you are able to control your weight and also to be in a good shape for the pregnancy. Or even during pregnancy, there are mild exercise for pregnant women to keep you in shape. I would also advise that we stick to our antenatal clinics. When you are given a date for your clinic, do not miss it for anything. If you are traveling outside your area of clinic, kindly take your antenatal booklet. That is your passport as a pregnant woman. You can take it to all facilities so you continue your management there. And during your management, there are tests that we do for you to help you to know that whether you are at risk or not. This test is done by screening you. So it is done by doing a fasting blood sugar. That is, in this test, you are being asked to come to the hospital, and they ask you that do not eat before coming. That is when we do the fasting blood sugar for you. And when we get to know the level and compare it with the standard that we have, we can say that you are not at risk. Also, when it gets to 24 weeks to 28 weeks, mostly, there is a test that we make you do where you have to not eat. You come, they will do a sample test, then you take in food, and they will check. That is called OGTT. Yes, so it is called like OGTT. That is called oral glucose tolerance test that we make you people do, and some women even find it to be so stressful and time wasting. This is one of the best tests to help you too, and I'm assuring you that when you do this and we get to know that you are at risk, all the management will be put in place. You will be asked to eat very well to control your diet so that you can reduce the amount of glucose in your blood. And then ultrasound scan is done for you mostly, so that we know how the baby is growing and the rate at which the baby is growing, whether it is normal or it is abnormal, that is if the baby is going overweight. And when you get to a particular gestation or a particular weeks or month in your pregnancy, you'll be given a fetal cake chart where we'll be allowing you to count the cakes of your baby, so that the placenta insufficiency or the malfunction of the placenta when it's getting to the end of the pregnancy does not make you lose your baby. So dear, let me assure you that even though you are having high blood sugar or you have been diabetic from childhood, and if it is under control, I promise you that you can have your own child with well management. I assure you that no matter the level of your sugar level, you are going to have a successful pregnancy. We come to the end of this discussion on high blood sugar in pregnancy. But before I leave this topic, I want to tackle a bit of the effect of high blood sugar in men. For men with type 1 diabetes, they could have erectile dysfunction as time progresses, and also there is an effect on their sperm motility. So the movement of the sperm is impaired one way or the other. Also, there is a little bit alteration in the sperm DNA for men with diabetes. So we come to the end of this, and what do I expect you to do? I want you, couple full of love, to adhere to preconception care. Preconception care is the best you can get so that you have a beautiful family. No matter your health condition, preconception care is the best before you begin a family. And I would want to end this by saying thank you for having time to listen to my few minutes of talk on high blood sugar. See you next time. Bye-bye.
PraiseZion.com